Hey everyone, Danielle Wadsworth. I'm going to be going over my case study with my breast screening patient. So my patient that comes in is a 40-year-old woman. She presents to my clinic for a periodic health exam. She is healthy, has no known risks for any particular disease. She does not smoke. She is sexually active, and she is not currently pregnant. She is, however, wanting to have a mammogram, so I'm going to discuss the age requirements, recommendations, and see how she feels about that. Is there any particular reason that you would like to have a mammogram done today? Have you found a lump? Have you noticed any dimpling of your breast tissue, any discharge, anything abnormal? She has not. So women who have a child, sibling, or a parent with breast cancer are at a higher risk and may benefit for having starting the habit screening done in their 40s. According to your chart, it doesn't look like you have any family history of breast cancer or the BRCA gene. Is that correct? That is correct. Okay. So I just asked because it's important to weigh the risks and the benefits. The accuracy of a mammogram has actually been shown to improve as a woman ages, and only about 85% of breast cancers are actually detected with a single mammogram. Now, if something were to show up suspicious, we would have to have you come back in for further testing, and that could include blood tests, MRI, biopsy. And actually, at your age, sometimes the false positives can cause more anxiety and worry than is actually necessary. So the recommendations are slightly different between the U.S. Preventative Task Force and the American Cancer Society. The task force says that mammography screening in women before the age 50 should be determined based on the individual basis and the risk factors. I do, however, want to let you know that there is current research that shows that beginning a mammography screening at a younger age can actually increase the risk of overdiagnosis and treatment. Although the old American Cancer Society guidelines used to suggest a woman starting their screening at age 40, they've actually pushed that age back to 45 due to evidence showing that the risk for breast cancer in that 40 to 44 age is really, really low. And there is actually more harm that has been shown to be done in women with false positives than is actually worth their anxiety. So the General C recommendations, according to the U.S. Preventative Service Task Force, means that they recommend selectively offering and providing this service to individual patients based on a professional judgment and patient preference. There is at least a moderate certainty that the net benefit is very small. After hearing all of this information, would you still like to go through and have your mammogram done today? She says no. Okay. Since you're okay with waiting, I would suggest following the American Cancer Society's recommendation for women that have an average risk of breast cancer. So women who do not have a personal history of cancer or are suspected or confirmed BRCA gene mutation or have had a history of radiotherapy of the chest. And their recommendations actually are to start having a routine annual screening done at age 45, and then once you turn 55, we can actually start doing your screening biannually. Is that something you're okay with? Okay. So in the meantime, some ways to actually prevent breast cancer would be to limit alcohol. So the more alcohol you drink, the greater risk of developing cancer you are. You should limit yourself to less than 1 drink a day. Even a small amount of alcohol can increase your risk of cancer. Don't smoke. Evidence suggests that there is a huge link between smoking and breast cancer. Control your weight. Being overweight can increase the risk of breast cancer, especially in women who are obese. Try to be physically active. Physical activity can help you maintain a healthy weight, which also helps prevent that breast cancer. Most healthy adults should aim for at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity weekly. Plus, they like you to add in some strength training at least twice a week. Easier said than done, right? So breastfeeding has also been shown to have some great protective benefits. And then limit your duration of hormone therapy. I know you're not there yet, but combination therapy has a 3 to 5 year increase on the risk of for over 3 to 5 years can have a risk for that breast cancer. So when you do get to the age that you may benefit for some hormonal therapy, we'll just have to kind of keep an eye on how long you're actually on it for. And then finally, avoid the exposure of radiation and environmental pollution. Medical imaging of high dose radiation can definitely cause some breast cancer. And there's actually been some research that has shown that there's a huge link between breast cancer and multiple exposure of radiation over a lifetime. So multiple MRIs, multiple, just different exposure to it. It kind of adds up on itself. So we try to limit the amount of exposure that a person has unless it's absolutely necessary. Any questions? I know I gave you a lot of information. Perfect. Well, thank you for coming in today. If you do come up with any questions, please feel free to give my clinic a call, and we can try to answer some of those for you, okay? Perfect. Have a great day. Thank you.